Have you ever wondered what options you have when it comes to shoulder replacement surgery? Orthopedic surgeon Dr. Thomas Sellers has you covered with the answers you need to hear.
Everybody has a little bit of a different reason for having a shoulder replacement. In general, it is a quality of life decision, so usually there's something that they can't do that they want to be able to do, or perhaps it's just simple things like sleeping comfortably. A lot of people complain that they can't get rest at night and it keeps them up. Other people, it's just putting their clothes on without discomfort. Even just basic activities of daily living can become challenging due to the pain, but also the functional limitation with motion. Stiffness is a big problem with arthritis, and so just getting some of that improved with the shoulder surgery just can help basic things become a little more easy, a little more tolerable. Some patients think that they may be too old to have a shoulder replacement. That's something that I hear a lot from patients, and really any active individual that is looking for a better quality of life is a candidate, so I certainly don't put an age cutoff on it. Don't let that be a deterrent if that's something you're considering, because really it's just about improving your quality of life. And shoulder pain can be a nuisance to deal with. I just want to make myself available to anyone who may have questions about shoulder arthritis, about shoulder replacement. Just kind of happy to offer myself to the community just to kind of be there to field questions in person. There's obviously a lot you can read online, but it's nice to probably be able to speak to a surgeon directly. And so we'll plan to be there and available for that.
Join Dr. Sellers for a free joint replacement seminar on June 27th. To register, visit BaptistJointSeminar.com or scan the QR code on your screen.